Here, I just wish to tell you that in the beginning of this year only, there was half-page information about osteoporosis in adolescents, and I think it was an eye-opener for all the medical fraternity that younger age, when you do not suspect that osteoporosis is common, it is getting rampant. And very rightly, Dr. Chitra pointed out to that we don't bother about what we're taking and we just don't exercise at all. Again, today's paper, there has been a clarion call given by the orthopedic people that because of the protein preparations and because of the steroids used left and right by the doctors, there is increase in incidence of not only of osteoporosis, of aseptic necrosis of hip bones, and you find this is aggravated after the COVID times. It is going to be a very simple one. Don't take it as an academic exercise. It is just what you and me know about it and practically do. So talking about the management strategy of bone health in senior citizens, we all are belonging to that particular category, and you can find in this particular group, people are there from 60 to 84 in this particular group. So it is for all of us. And very rightly, Dr. Taru had mentioned that 1 in 3 women after 60 have osteoporosis. And this is what I got the information from the Indian data which was available. And I attempted Dr. Taru's question, and I lost 1 mark of mine. She said it is 50%. So I think, this is what Taru's final word is, that in Indian women after 60 years, the osteoporosis is 50% and not 1 in 3. The hip fracture, it is in men, it is said it is 1 in 5, and ladies, it is 1 in 3. But as we go by what Dr. Taru says, is 1 in 2. The hip fracture carry, we all know, 20 to 30% first-year mortality, which is earlier it was almost 80%, and now it has come down to 20 to 30% with better care and better timely surgery. The fractures are preventable. Awareness, detection, and action. Dr. Veena Acharya definitely told us that both her husband and wife are old, so they have definitely saw to it that the slippery atmosphere from the bathroom is taken care of. And that is the kind of tile arrangement or rug arrangement has to be made right in the bathroom itself. So it is awareness, detection and action. I think many countries are doing a good job for old people, providing a good light. Sensor light is there in their rooms. The moment they step down from the bed, the lights open up. And they have given a torch, which is very handy. अपने वो wrist में डाल देते हैं, so at least whenever they go, the light is not the problem. The rising burden of osteoporosis is seen with longevity because we have started living for a long time now, and you can take it from us that it is 75 for we Indians. The importance of early screening and proactive bone health is very, very important. Japan is one country which has made it universal that the DEXA should be done at age 40. And in case if you have to take a preventive step, if you start doing these steps 10 to 15 years before, then probably you can definitely undo the harm which has been done in earlier years. And as Dr. Taru said, it is not T-score, it is Z-score after 35 years. So you can take it accordingly. Normal is less than -1. Osteopenia is -1 to -2.5. And osteoporosis is Z-score less than 2.5. The normal DEXA does not mean no risk. Here, I just wish to emphasize that the normal DEXA does not mean no risk. If you have a balance issue and if you don't take preventive problems, then you can land up, if there's a fall, you will definitely have fractures. Now, if the DEXA is normal, our goal is to maintain bone health. Weight bearing exercise के बारे में बहुत importance है और इसके बारे में I think we will definitely talk about what weight bearing exercises. I know a very simple exercise of weight bearing, and people like me do that particular exercise. And I think, if it is less, the other people can suggest what has to be done. 30-minute brisk walk daily करें, या उसका योगा ऑल्टरनेटिव करें, या उसका कोई भी ऑल्टरनेटिव करें. 30 मिनट्स आपकी एक्सरसाइज होनी चाहिए, बहुत जरूरी. You can use a resistant bands, or you can take an alternative for that. Light weights up to 2 kg. कहते हैं वॉक करना है और वेट उठाना, वॉक करना और वेट उठाना, यही काम आपने करना है. Then you'll find that your bone is great bone is there, and this you should do at least 3 times in 7 days. Balancing training is very very important. चाहे आप Chinese की बड़ी slow and elegant Tai Chi सीखें, या single leg standing to avoid fall. People like me find that I'm concerned about falling myself. तो थोड़ा सा बेड के बराबर में आप खड़े हो जाइए. You can do it, and you have to do it 30 seconds for one leg and 30 seconds another leg. If you can do morning, evening, it is great. Sunlight, it is 15 to 20 minutes, 5 times in a week. And I think whatever I have gathered, it has to be before 10 o'clock. It's a morning sun. Calcium, we need to take about 1,000 to 1,200. Vitamin D3 should be in the dose of 800 to 1,000 international unit. And it can be taken in a monthly sachet, or it can be taken that way. Avoid tobacco, smoking, alcohol, and caffeine. Both, caffeine and alcohol, they leach the calcium. So I think, that's the right word for this. And we should try to see that people who don't take that kind of alcohol, but they take caffeine left and right, दिन में 5-6 कप कॉफी के पिएंगे, उनको भी ये याद रखना चाहिए कि it is not good for their bones. And you find that Madam just now spoke about the smoking and alcohol increase is tobacco increase is increasing in our country as well. DEXA should be done even in the senior citizens every 2 to 3 years. And I think, it is good that all of us should join a bone health group and start motivating and inspiring each other. Now, this particular slide you may find is unnecessary, but, what about, the things which I've just now mentioned? I mentioned about the sun, the exercise, the calcium and the vitamin, and, our lifestyle, what we need to change. Now, what about using bisphosphonates? I've never read in any of the books, but I found, this is my experience with interacting with 2-3 Japanese doctors, what they do it. They find that the first line treatment of bisphosphonates are first line treatment for osteoporosis. They are not indicated in any of the books for a normal scan in 60 years plus, or in people who have osteopenia. If you have a normal DEXA at 60 plus, should you consider this bisphosphonates? It is said that you can take it with caution. I have been using bisphosphonates, advising people who have a normal DEXA. The normal DEXA is seen only 30% of people beyond 60 years. And I advise them either alendronate 70, which is osteophos 70, or give them a yearly injection, zoledronic acid 5 milligram for 3 years, and they can take a break holiday for 1 or 2 years again, depending upon what that DEXA thing. This is highly controversial. I haven't across people talking about it, but I've been using it, and I will tell you in the end that we have something like 200 people who have had their DEXA at 40 years, and it was normal, and they have been taking vitamin 500, this calcium 500 along with their diet from age 40 years. They are taking supplementation. When we say they're taking supplementation, you can take it from me. They must be taking supplementation for 9 months in a year time and not continuous basis. So this is what it is. It is subject to a lot of criticism, but this is what I have been doing in my own practice. Now, what about Desi Ayurvedic treatment? You've seen our elders talking about it. पहले वो लोग घर में पान लेते थे, और पान में वो जो चूना और ये कत्था लगाते थे, तो बताते थे कि इस चूने का ये महत्व कि आपकी हड्डियां जो है मजबूत रहेंगी. And this is the same thing I've been doing it for a long time. पान की दुकान पे गीला चूना मिलता है और गीले चूने को हम कहते हैं कि आपने चने के इसके चावल के दाने के बराबर आपने यूज करना है एक कटोरी ऑफ दही में और एक कप दूध में, छोटे से दूध में आपने इसको यूज करना है. एंड दिस इज ऑल्सो गुड सोर्स एज फार एज देसी मेडिसिन आर कंसर्न. Now, 5 strategies to catch trouble before it catches you. These strategies are DEXA scan every 2 to 3 years once you are 60 plus or younger with risk factors. I get in majority of my patients who can afford preventive DEXA at 40 years because by that time they've completed their families and this is the right age for them to assess where their bone health is. And this I've been doing it for a very long time, decades and decades. And one can use a FREX score to estimate fracture risk. But the audience which are having, which is 80 plus audience who are watching this particular thing, I find it is still not very friendly for each one of us. आपको खोल के देखना पड़ेगा, फोन में देखेंगे इंटरनेट है कि नहीं, फिर उसको स्कोर का एस्टिमेट करके पेशेंट को लिखना पड़ेगा. वो एक्स्ट्रा 3 or 4 minutes we are not ready to give for our patients to assess the fracture risk for them for the next 10 years. Whenever we are elders are there, I think you remember our elders talking about it. Track your height when you are elderly. Whenever you find there's a loss of 2 centimeters, it may suggest spinal collapse. You should be, on guard for it. Dr. Taru had shown a beautiful picture how the spines collapse. And it is, you can exactly mention, which is there, the loss of more than 2 centimeters suggests spinal vertebra collapse. The fractures are taking place there silently. Do an annual fall risk check. This has to be done. I think, we are all doctors and, we should see to it that हमारा गेट कैसा है, हमारा विजन कैसा है, हमारे न्यूरोपैथी के कोई फैक्टर्स तो नहीं है, कोई आपको पेरिफेरल न्यूरोपैथी वगैरह तो नहीं है. अपना मेडिकेशन को रिव्यू करें और हमें कुछ एक्सरसाइज सीखनी है. और ऑलमोस्ट देयर आर 10-12 एक्सरसाइज आर देयर which you can do to balance your gait. And all people who are moving about and can do it, they should definitely be doing to check, to decrease the fall risk in your patients. So firstly, you have to check how much risk you have. And secondly, you have to correct it by doing regular exercise to increase your balance. Dental checkup also matters because it is said that jawbone health mirrors skeletal health. तो आपको जब आपकी डेंटिस्ट बोलेंगे ये मैडम आपकी जो जॉ लाइन है इसमें बहुत सारी ऑस्टियोपोरोसिस है, आजकल नॉर्मली वो एक्सरे कराते हैं तो उससे आपको पता चल जाता है कि आपके जो जॉ की पिक्चर वो दिखा रहे हैं, हमारी अंदर भी सब कुछ वही होगा. Now, if there is an osteopenia, do not ignore it. We have, by every cost, we have to prevent progression to osteoporosis. All normal measures which we have been taking, that you take calcium supplementation, D3 supplementation, we have to change our lifestyles. Diet आपने थोड़ा सा कम खाना है, you should be very conscious about it, that you definitely take those products which are rich in calcium. You must walk. And balance drills आपने करनी जरूरी है, and it works. I will talk next month on, strong legs, speak about smart elderly people. So we'll have a session next time on stronger legs. Add weekly bisphosphonates even in patients who are osteopenia. Again, I can be questioned for that. It can be given on a weekly basis, alendronate 70 milligram, or it can be given on a yearly basis. You give it for 2 years, give a halt for 2-3 years, again take it for 2 years. And this is a way you'll find that you will not land up with things. Whenever we go, our whole unit goes for DEXA checkups, and every time we get congratulations from that particular group, and वो पूछते हैं कि आपका secret क्यों है. उनके हिसाब से 60 years plus अगर आप हैं तो 70% will have either osteopenia or osteoporosis. And when they find that our scans are normal, they definitely get surprised for the same. Raloxifene helps both bones and the breast cancer risk, so that is the drug of choice in those groups. Consider HRT if you are within the 10 years of menopause and you have the symptoms, other symptoms as well, so you can consider HRT in this case. Madam Manju was talking about vitamin K2. I was going through the literature. I came across there is a vitamin K1, which is the plant source, and vitamin K2, which is animal source, and it is available. It should be taken in the form of 15 to 30 milligram daily tablets. It has to be taken along with vitamin D. So I have to do a research here. What are the preparations available in our country where we can combine with vitamin D and calcium? It can be a very powerful, low-cost addition for calcium deposition. This practice is there in Japan, and when I'm talking about it. If osteoporosis is there, the goal is halt bone loss and prevent fractures. The first line is that you, along with the calcium and a vitamin D, and now the K2, which I'm talking about, you have no other alternative but to take first line drugs for osteoporosis, which is oral bisphosphonates, alendronate, and I talked about the alternative for the same. Risdronate is a mild on stomach, and zoledronic acid 5 milligram. I'm very fond of this particular drug because otherwise weekly tablets, often me and my friends tend to forget about it. And we have a group of 5 doctors in our clinic. We used to take it on a monthly basis, and we made one sister in charge of it. But, this works for 2 months or 3 months, and then again there is a gap. So I think zoledronic acid 5 milligram yearly on your birthday is the best thing, for people to remember. Just one drip, finish over a period of 15 minutes. Probably it is the tablets we tend to forget, and this will overcome it. Now, denosumab is people who are orthopedic surgeons, they are fond of this particular preparation. It is 60 milligrams subcutaneously every 6 months, but the dose is exorbitant. The cost is 8,000 rupees, and 120 milligram, the cost is almost 15 to 16,000 rupees. It is safe in chronic kidney disease also, but it is advised you cannot miss the dose. आप लेना है तो लेना ही है, नहीं तो फिर this will be harmful. So एक बार you have to make up your mind, see whether economically you're sound and you can afford this particular medicine for yourself, provided you have osteoporosis. It is not to be played by people otherwise. It is only people who are osteoporotic, beside bisphosphonates, they can take this additional things, which orthopedic surgeons are very fond of giving. It is subcutaneously preparation, and many of our patients do tell that, Doctor Sahab, wo log dete, aap kyun nahi dete? So the question is of investment on this particular drug. You have once you have to stock it in your place. Anabolic teriparatide for severe bone loss or vertebral fractures is also advised. And again, this is not very popular. And beside this, we have to continue the calcium and D3 beside exercise and other things. So this is, in short, the treatment of osteoporosis to halt bone loss and prevent fractures. Now, managing bone is a marathon task and not a sprint that aapne thoda sa walk kar liya to baat kaam ho gaya. You have to monitor it, and you have to see the safety point of it. Madam has already talked about it. You can get serum calcium level done, but I was told by always we do a blood calcium. आप 100 cases करेंगे तो एक का कई बार आपको borderline calcium मिलेगा, because the blood calcium does not speak about the bone calcium, क्या उसका वहां पर level है. तो इसलिए I find serum calcium, test is useless test. Vitamin D3, we are all getting it done. There are people who do twice a year, and always get your creatinine or what kidney function test before therapy and on a yearly basis. I feel DEXA should be done whether you have a normal bones and whether you have osteopenia or osteoporosis every 2 years. Dental evaluation also should be done before you take bisphosphonates as a therapy for yourself. Watch for osteonecrosis of jaw, which is a very, very rare phenomenon. And I did tell you that, people who have a normal DEXA can take a bisphosphonase holidays. After 5 years, you can pause for 2-3 years, and then you can again take for 5 years. Home safety, I think all of us, we should become more sensitive about it. In our house, we should remove rugs, improve lighting, install grab bars, and make our life comfortable. India's specific advantage, just now, Madam talked about it, that we have Jan Aushadhi stores now, and where you can find the medications are cheaply available, and they are not, वो कहते हैं खड़िया है नहीं, ये खड़िया नहीं है. I think, प्रधानमंत्री के स्टोर से लीजिए, तो you will find that those are matchable as far as quality is concerned. And Flex score, where DEXA facilities are not available, I think we should make our youngsters use this score for their patients. And this thing can be utilized much, much more. It's a very simple chart which one can do it. So our mission is strong bones give your strong confidence, and they are because your strong bones are your silent partners. So individualized evidence-based approach is needed for all of us. Empower seniors to age actively with strong bones and remain independent at 80. So let's pledge to test and treat ourselves like we do for others. Stay socially and mentally active. Again, I say stay socially and mentally active. It reduces falls, frailty, and fear because you're inspired by your own colleagues and you will do something for yourself. Thank you very much.